Hi everyone, my name's Em Griffiths and I'm a research associate in the Shaw Public Health Bioinformatics Lab at Simon Fraser University in Vancouver, Canada. In this video, we'll be discussing how data standards can be used to harmonize COVID-19 datasets generated by different groups. We'll start with an overview of how public health genomics has played a key role in international responses to the COVID-19 pandemic. Next, we'll discuss the challenges of integrating public health data generated by different organizations, and then we'll take a look at how data standards are being used to harmonize data across jurisdictions for Canadian COVID-19 surveillance and outbreak investigations. The sequencing and sharing of SARS-CoV-2 viral genomes with public databases like GISAID, the Sequence Read Archive at NCBI, and the European Nucleotide Archive at EBI has had enormous benefits during the pandemic, from tracking the spread of the disease throughout the world, within countries, and during particular outbreaks, to providing genomic information for the design of quantitative RT-PCR diagnostic tests, as well as vaccines, to refuting misinformation about the origins of the virus. When we talk about public health genomics data, we don't just mean the sequence data. We're also talking about the contextual data. And by contextual data, I mean the sample metadata, as well as the lab, epidemiological, clinical, and methods information that are critical for interpreting the sequence data and making informed decisions based on analytical results. And it's contextual data combined with sequence data that enables us to characterize lineages and clusters, identify variants with clinical significance, and correlate genomic trends with outcomes and risk factors. Getting the right information to the right people is absolutely critical during public health emergencies, whether that's via data sharing within an organization, between trusted public health partners, with international organizations, or with repositories. But sharing can be difficult when contextual data is encoded in different ways. For example, on the left side of the slide, you can see excerpts of case report forms used by two different public health agencies right here in Canada. Now, for those of you who are unfamiliar with them, case report forms are the forms a healthcare worker fills in to collect patient information when they go to a testing center for a COVID test. While both forms describe the specimens that are collected for testing, they describe them at different levels of granularity, using different terms and abbreviations. And while a human can probably figure out how the information is related, a computer can't unless you tell it exactly how. And these issues perpetuate from organization-specific databases out to public databases where metadata standards are largely broad to encompass many different use cases and pathogens, and users are left to apply them as they see fit. As an example, on the right-hand side of the slide, you can see two different contextual data records from the same public repository where information is encoded using different templates and standards. So the fields are different, there's a lot of free text, and there's information like latitude and longitude, as well as age and gender, that in some circumstances could be considered re-identifiable. The Canadian COVID-19 Genomics Network, or CANCAGEN for short, is an example of a national sequencing effort with the goal of integrating viral genomics data from across the country to perform public health surveillance, as well as integrating human genomics data with viral data to better understand pathogen-host interactions, patient outcomes, risk factors, and to develop potential therapeutics and improve diagnostics. Now, what you need to know is that Canada is a country made up of 10 provinces and 3 territories, and it has a decentralized health system in which healthcare is under the jurisdiction of the provinces and territories. So harmonizing and integrating all of this information across different data sets and databases is not at all trivial. The Public Health Alliance for Genomic Epidemiology, better known as phage, is an organization focused on improving the reproducibility, interoperability, and accessibility of public health microbial bioinformatics analyses, platforms, and datasets. To help structure contextual information, phage created a data specification with an emphasis on public health needs and interoperability that provides standardized fields and terms for describing repository accession numbers and identifiers, sample collection and processing, host information, host exposure information, sequencing methods, bioinformatics and quality control metrics, pathogen diagnostic testing details, as well as provenance and attribution, so that all data generators are acknowledged for their contributions. The vocabulary for the standard was sourced from a variety of local, national, and international case report forms, as well as public health surveillance and repository requirements, as well as existing metadata standards that were all harmonized by consensus. It should be mentioned that a number of phage members participate in different SARS-CoV-2 sequencing initiatives, like COG UK, SPHERES, Australia's Communicable Diseases Genomics Network, the Latin American Genomics SARS-CoV-2 Network, as well as CINECA. Now, it's one thing to develop a standard, but it's another to enable public health workers to actually start using the standard. So our public health genomics lab at Simon Fraser University built a harmonization tool called the Data Harmonizer, with the goal of enabling users to harmonize, validate, and work with their contextual information in a private and secure way, using standardized vocabulary that they're familiar with, and to structure this information so that it's more interoperable and more easily reused for different kinds of analyses. Essentially, the Data Harmonizer is a spreadsheet text editor based on the CINECA phage SARS-CoV-2 contextual data specification, which can be used by any lab wanting to use the standard. So some of the fields allow more flexibility, and you can enter free text descriptions, while other fields, like those with dates, provide specific formatting. Other fields provide drop-down pick lists of standardized terms, and some fields provide automated transformation, like binning of age values into specified tenure intervals. Other fields enable search and autofill. Once a user has entered their data, they can perform validation at the click of a button. They can then either save their work or export the entered data in different formats, which helps to expedite the preparation of submission forms for different repositories. Taken together, by using an international data standard in combination with software that enables public health practitioners to implement the standard, agencies that collect patient and disease data in different ways can better harmonize and integrate information for national surveillance. Furthermore, the standard also better enables integration of Canadian surveillance data with international data in databases like GISAID, as well as SRA and ENA at NCBI and EMBL-EBI as part of the INSDC collaboration to help in the global fight against COVID-19. Thank you for watching this video on the application of data standards for harmonizing and integrating public health genomics data as part of the arsenal being used in the COVID-19 pandemic response. If you're interested in implementing data standards and would like some advice on getting started, please contact a member of the CINECA Data Harmonization team, or feel free to send us an email at info@genepio.org. See you next time.